we have our speaker here with us today, and I have a short introduction about her, and I'm very, very happy to welcome her. We have Dr. Aishwarya with us. She's a radiologist with a passion for exploring the stories behind the greatest medical inventions and breakthroughs, and you will hear from her a lot of stories today. But that's not all. She's also a talented artist who brings creativity into everything that she does. So Dr. Aishwarya will guide us through this fascinating history of medicine and share the latest advancements shaping the future of healthcare. She also has some very interesting questions and very interesting stories about healthcare to share with all of you. So get ready on this exciting journey. And yes, this is going to surely be an inspiring session. So let's give a big welcome to Dr. Aishwarya. So yes, Aishwarya, you can take over the session. Aishwarya, can you please unmute? Sorry.
Yes, thank you very much. Thank you for your kind words. Okay, so we'll begin with the session now. Yes. Okay, is the screen visible?
Yes, it is.
Okay. So, hello everyone. So today we'll see about the journey of modern medicine. So how it was so many thousands of years ago and how it is now and how we have come through all those years to reach where we are today. Okay, so this is a journey of medicine from magic potions to super robots. Okay, so what comes to your mind whenever you hear the word medicine?
You can all type your answers in the chat box.
Yeah. So whatever the first thing comes to your mind whenever you hear the word medicine.
We have some answers. Vijeta says tablets.
Okay.
Nirmal says pills.
Okay, so whenever we hear the word medicine, generally we associate it with the tablets or pills or syrups or whatever we take on the over-the-counter drugs or something like that. So today we are talking not just about those medicines, we are talking about the medicine as a science, how it has evolved through the years. Okay, and medicine does not involve only those tablets or pills or syrups. It also has other aspects to it, which can be either research or imaging or surgeries. So all of them come under the science of medicine. Okay, so today we are going to see how it all developed. Okay, so now the second question. What are the different home remedies that you have used at your houses? So you might have all used so many things to get cured of cold or cough or something, and you might have avoided going to doctors. So what are the things that you have used over the years to
Nitin
get...
says any. Oh, sorry.
Yeah, no.
Nitin says anything with therapeutic value. Ananya says turmeric plus pepper plus honey for cold. Nitin says spices and condiments.
Okay. So they're all very great answers. Do you all remember what you did when COVID came, COVID hit for the first time? What was the home remedy that was used? Anybody has any answer for that?
Vijeta says kashaya.
Yeah. So, and sometimes when you have stuffed nose or blocked nose, what do you do at home?
Steam inhalation. Chokamal says that.
Yeah.
Ananya says inhaling. Nirmal says steam.
Yeah. So all of these are home remedies that we've been using since a long time. Like since our elders know this because their elders used it and so on and so forth. So these things have been passed on from generation to generation. But many of us we don't know why it is used, why the same things are used for some ailments, or why we should take honey, pepper, and turmeric, or why we should use ginger, garlic, and all in our daily food routine and all of that. So what happened was thousands of years ago, when the people were falling sick thousands of years ago also. So then the people, when they wanted cure, they would go to some sages around their houses in India, or similarly there were other schools of medicine developing in ancient Greece, Egypt, or China. So there were many schools of medicine developing at a time. So what they all used was whatever was available in their local nature, surrounding nature. So they used so many types of herbs or so many potions to cure themselves and others of their age. So from that time, we have been using some things like turmeric or ginger or honey and all of that to cure ourselves. And but we don't know why. They found a pattern in the olden days that maybe turmeric solves some sore throat problem, or we can use honey to apply on the wounds. So on and so forth. So once the pattern was formed, they started just using it, and I don't think many people know about the research or know about the knowledge why it is used even today. So the modern medicine has questions like what causes the diseases, how does our body react, and what are the remedies and how do they act. So in modern medicine, we will ask the basic questions like what is that which is causing me disease? Why am I falling sick? So now we see what causes the diseases. So do you have any idea what causes the diseases?
It says germs.
Yeah. So germs is a very broader terminology. So it is vaguely saying cars, but I'm asking what
Choma
exactly
says
cars.
pathogens.
Okay. So pathogens is a scientific term to say germs. Okay, so pathogens involves bacteria, viruses, parasites, and fungi. So these are also four broad terms. There are so many other pathogens that can cause disease to us. So you can identify the blue virus that you can see here. We are all very familiar with it since last 3-4 years. So this is the tapeworm, which you might have heard from your elders that you have to take deworming tablets once every 6 months and all of that. And these are the fungi. We might have seen the fungal infection or yeast infection in the winter days or monsoon days. So all of these pathogens, they are constantly present in our surroundings. So they are always when we are working, when we are eating, when we are laughing, playing. So they are all always there. So we are constantly
We also
surrounded.
have one more interesting answer: defective genes, imbalances of hormones from Nitin.
Okay, so defective genes and imbalances of hormones, they definitely do cause diseases, but that affects our body internally. So these are the pathogens which act externally. That is a very good answer. So that is why I told not just these four things, we also have so many other things which causes diseases in us. So Nitin, that is a very good answer. So uh, now we know germs are something that can cause us disease when it comes externally into our body. So how do you think these germs enter our body?
The
Is it
poll
only
is
by food?
open. Yeah, the poll is open, so everyone can vote. We'll give you 30 seconds for everyone. We can start voting. You can also have multiple responses. So,
Yeah.
okay, there are people voting for food and water.
Okay.
For okay, water and food, almost the same. There are no votes for skin or air.
Okay. Okay. So have you all forgotten that what happened 2-3 years ago when COVID hit us? So the COVID was not just traveling through water, it was also coming through air. So that was a major airborne disease. That is why most of us got sick. So the pathogens can enter our body through all the four routes: food, skin, and water. Okay, the skin, in the sense when we fall or when we get a cut. So through that cut or whenever there is a breach in the skin or mucous membrane, so through that the pathogens can enter our system. Okay, so now we know what causes the diseases and how do they enter our body. So we should know once the disease causing agents enter our body, how will our body react to them? So our body is designed in such a way that it has to protect itself at any cost. So we are made to live. So our body has to have something in it to fight against these germs. So think of our body as a country. So the country has a defense system in place itself from the external invaders, right? So similarly, our body has a system in place to protect itself from whatever enters inside, the germs or pathogens or whatever it is that enters inside. So that what happens when these germs enter our body? So imagine that okay, before all of this, that system, that defense system which we have in place, that is called immune system or immunity. You might have all heard about it in the from during the COVID days, or even before it was in news. But after COVID, we are more concentrating towards immunity, how much immunity we have, or what to do to improve immunity, and all of such things. So immunity is, you can remember that as a defense system of our body, and it has so many cells, just like our defense system has army, navy, air force, and all of that. Our body's defense system also has so many cells doing so many works. So I'll be telling some of the cells names that might be a little bit advanced for you. You can just remember that those cells help us uh, get better. Okay. So what happens when the germs enter our body? We'll take a small scenario where we get cut. So you are walking in a street and you hit yourself or hit your hand to a fence or something, and you get a small cut. So immediately you see that there is blood coming out of the wound site. So the blood comes out because of the blood pressure that we already have, and it also tries to wash away the pathogens which have been attached to the cut or the skin. But sometimes the what happens is the germs enter the body nevertheless. Then what happens is our body cannot lose any more blood, so we have something known as clotting system in place. So our body starts to clot the blood, and the blood clot shuts the wound. So the germs which have entered the body, they have stayed inside the body, and now it is time for them to grow. So they grow and divide so much that their number increases by thousands to thousands within seconds, and they start circulating everywhere in our body. So this is when immunity comes into action. So whenever there is a germ which is dividing so prolifically inside the body, what happens is our body sends some cells known as macrophages. So macrophages literally translates into big eaters. So what they do is they come, they catch hold of the germs, and they start eating them. Also, they send an SOS message through the blood to all other parts of the body saying there is some germ which has entered into the body. We need some help immediately. So whenever that SOS message is sent in the blood, what our blood has, apart from red blood cells, white blood cells, platelets, and all of that, is some cells known as lymphocytes. So those lymphocytes and neutrophils, they are the cells, they are also a second line of defense in our body, and they start coming to the site of injury. So now the macrophages have sent a message saying there is a cut on your right thumb, and the neutrophils and lymphocytes from the blood vessels have started rushing towards your right thumb. Okay, so then we notice there is a small bump which is formed around the cut. It is very red, hot, swollen, painful. So all of these inflammation. So what happens in inflammation is that the body tries to raise the temperature so that if the germ is temperature sensitive, it can die there. There will be increase in the blood pressure and the blood flow towards that region, because once the blood is increased, the lymphocytes and neutrophils can reach the place easily. And there is also something known as pain pathway. So whenever there is a cut or something to our body which is not supposed to happen, our body senses it as pain. So pain is also a protective mechanism in our body which says that, which tells our body that something which is not supposed to happen is happening. So all of these together constitute an inflammation. So once there is inflammation, the lymphocytes, apart from defending our body from the pathogens, they also have one more action where they have something known as memory cells. So from the time we are born, we are surrounded by germs, but we don't fall sick every day or very often. That is because our body can fight some of the pathogens without our notice. So without bringing into our notice or without causing any symptoms, our body has that power to fight against them. And whenever it fights against any pathogen, it has something known as memory cells, which is kept. So those memory cells would have fought against a particular pathogen and they know how to fight it precisely. So what the lymphocytes do is that they try to identify this germ which has entered our body, and they take it to every lymphocyte cell, and they try to identify what this germ is made of. So once we identify the memory cell for that particular germ, what happens is that memory cell starts dividing rapidly, just like our germ which is divided so much. These memory cells also start dividing in thousands and millions in numbers, and approximately 80% of them are sent to the war field to fight against the germs, and almost 20% again become memory cells, because by now the body knows this attack is happening twice, so it might become more, so it needs more memory cells, and 20% of them become memory cells. So now these 80% of the lymphocytes which have been activated, they come to the wound site, they fight with all the germs, and the macrophages eat them up, and our body cleans it up. So this is how the body tries to take care of itself whenever there is a pathogen which enters our body externally. So it might be through food or air or skin, like cuts or something. And in the meantime, if the infection is too much, our body also raises its core temperature, which is when we get fever. So the same mechanism, that if the core temperature increases and if the pathogen is temperature sensitive, it might die. So we might have also noticed that sometimes in cases of cuts or wounds, there is something pus which is formed, right? So this pus is nothing but the dead germs and the neutrophils which have eaten so many germs that they have become inactive now. So they are of no use to the body, and they all form the pus. So once we release the pus which is formed, we get rid of the pain, fever, or whatever the local discomfort that we have. And that is how our body tries to get better. So now we know the memory cells, and memory cells are kept in the body. So what happens to the memory cells when there is an attack again? So when there is one more attack, our body knows which memory cell is there for which germs, and they fight off the germs. Um, so this is known as immunological memory. Okay, so that will help our body to fight against the germs very effectively and in a short period of time. So it doesn't take as long as it took in the first time to fight against the germ. So now we know that there is a disease and something that is causing a disease. So now there are two options with us. One is to stay away from the disease, that is to prevent the disease from occurring in the body. And there is something known as cure. So we can prevent the disease from occurring, or we can treat the disease. So better to prevent than to get a disease, right? So what do we do for prevention? So now we come to something very important known as vaccine. So we have all studied about memory cells, right? So we need memory cells to fight against the diseases. But I don't want all the diseases to come to me, so that I can develop memory cells for all of those diseases, right? So that is why we have something known as vaccine. So vaccines are nothing but killed germs or killed pathogens in a very small amount that have been introduced into our body, so that our body can form memory cells for those pathogens. So whenever we take vaccine for some disease, for example, COVID, we all got vaccine for COVID very recently, right? So whenever we take a vaccine, our body has the killed COVID viruses inside it, so that it can develop memory cells for COVID. And next time when we are exposed to the COVID virus, our body knows how to take care of it. So first wave of COVID first and second waves were so severe because that was a very new pathogen and our body didn't know what to do with it. So once the vaccines were developed, our body started developing immunity towards it. And immunity is nothing but the memory cells. So once there was enough immunity, the severity now has come down very drastically. So now, even now, we are seeing COVID positive cases, but we don't do a very big thing about it. We just keep them isolated in the hospital, and they get cured as well. So that is how the vaccines act. So how did we know there is something known as vaccine, there is something known as memory cell? We can form the memory cells inside our body. How did we know all of that? So can anyone tell me if they have seen some disease like this or something similar to this? Do you know what this disease is?
Says it's smallpox.
Okay. So anything similar to this? Anyone has seen it in the...
Says chicken pox.
Okay.
Ananya says chicken pox.
Okay. So um, you're all the smallpox is the correct answer. But since I asked if you have seen something similar to this, so chickenpox is a right answer for that. It looks similar to this. But the chickenpox is not so confluent as this, because smallpox, we can see the rashes coming everywhere on the body and it is so nearby. So sometimes those 2, 3 rashes combine together to form a very big pustule or abscess kind of thing. But chickenpox is a little bit uh, scattered rashes, and they don't form so much of pus. So smallpox was a very rampant disease some hundreds of years ago, and many people used to die because of it. It used to be so severe that it used to cover the whole body, and many of the kids and even adults have died because of it. So when there was the smallpox epidemic happening in the world, there was a researcher, he was a doctor by name Edward Jenner in Europe, and he noticed that his milkmaid had got similar disease in her hands, only to her hands. So after some time, when there was a smallpox outbreak in their region, she did not get the smallpox disease. So then he thought that maybe because she had the similar disease limited to her hands, she didn't get the bigger disease, the smallpox. So that is when he thought, why don't I try the similar thing, or why don't I try my hypothesis? So he started extracting the cow. That was because of some disease known as cowpox, because she was milking the cows, right? So that's how she had contracted the disease. So he extracted the material from cowpox and started injecting it into healthy persons. So after that, he noticed whenever there was a smallpox outbreak, those people who had got those injections, they didn't develop smallpox at all. So that was the first ever vaccine to develop in the history of our world. So that was how the vaccines came into being. You might have all seen this kind of a scar in your adults' arms, or in your parents or in your grandparents. You might have seen this kind of scar. It is because of the smallpox vaccine. So smallpox vaccine helped save so many of lives. It was made mandatory in all the countries so that the smallpox disease gets eradicated. And now the smallpox disease is not there; it's eradicated from our world. So there are many other diseases which are on the verge of eradication even today because of the vaccines. So do you know any such disease which is going to be eradicated, or which was almost eradicated and came back because of COVID?
A lot of them say polio.
Yes,
Polio.
yes, that is correct. So polio was almost eradicated just before COVID, and during COVID, because we could not vaccinate many people, the disease has come back. So do you know where it has come back now? Okay, so mostly in the some regions of Africa, it is seen now. But the problem is once they travel, it can travel to other countries also. So there are all the tries are going on to limit the travel of such persons, or the limit the spread of that virus. Also, do you know how polio virus enters our body? Any wild guess? No?
Water, air, food, infected water and food, water.
Okay. So the correct answer is through food and water. It enters through our oral route. So that is why oral polio vaccine was very effective, because when taken orally, some of the vaccine viruses, the killed viruses from the vaccine, they were also excreted. And this happens because of bad hygiene, right? The polio happens because of bad hygiene. Whenever there is polio virus coming in contact with the hands of food preparer or something, it goes into our body. So whenever there was excretion of the killed virus, the vaccine virus, that reached other people also because of bad hygiene, and they somehow indirectly got vaccinated. So that is called herd immunity, and because of that, many people, even though they didn't get vaccinated, they were protected from the disease. So that is how we were able to almost eradicate polio, and that is where all our try is towards now, to eradicate polio. Okay, so now we know prevention is not just about vaccines also. Not We cannot prevent all the diseases by vaccines, right? So how else can we prevent a disease?
Launch the poll so everyone can start voting now. There's a vote for washing hands.
Okay.
Some people say exercise, mostly washing hands.
Yeah.
Okay, there are few votes for balanced diet.
Mm-hmm. Okay, so except for eating junk food, all three are correct. So we need to have a balanced diet. We need to exercise regularly. We need to wash hands properly. So all of these help us improve our immune system, and also to prevent the entry of germ into our body, right? So we need to be very cautious about what goes inside our body and how we keep our body healthy. Okay, so now we know what causes diseases, how our body reacts to it, about the immune system, about the prevention of a disease. So now we come to the another part of remedy, that is cure. So when there were diseases occurring in the olden times, there were not many vaccines. There were not many. There were not many tablets or syrups or those things available to cure the people. So what happened was, some 80 to 100 years ago, there was a bacteria called Staphylococcus. So Staphylococcus was such bad a bacteria that it would cause sore throats, and people would die because of sore throats. So can you imagine people dying because of sore throats? Sure, it also used to cause some skin disease or the rashes and pustules on the skin, sepsis and all of that. But mainly it would start as sore throat, then it would increase so much that person had to be hospitalized and he would die there. So the doctors all around the world, they wanted to know what will stop staphylococcus, what will kill the bacteria. So that is when this doctor named Alexander Fleming, he wanted to do a research on what stops the multiplication of bacteria. So to see all of that, we grow the bacteria in a controlled lab area, and we test how it reacts to different materials or different things which are known to us already. So what Alexander Fleming did was, he used nutrient agar, that is the medium in which we grow the bacteria, in something known as a petri dish. So here you can see there is a small disc-like thing in front of his hands. So that is a petri dish in which there are some staphylococcus bacteria which is growing. So what he did was, he put the bacteria into the petri dish and he forgot to close the dish. He left it near the window of his lab and he went somewhere. So after some days, when he comes back, he sees that there is a mold which is grown on the petri dish. So mold is nothing but some kind of a fungus. You might have seen mold growing in the old bread if you have in your homes, or some old curd which is kept. So those black hairy things you see, so that is all fungus. It is commonly called as mold. Okay, so he sees that there is mold which is growing in his petri dish, and to his surprise, he sees that the bacterial colonies around these mold, the bacterial growth around this part of mold is not there, or whatever is there, that is becoming small and vanishing. So he realizes that there is something in this mold that is killing the bacteria, and that can work as a treatment for people who have had the bacteria in their body. So this is how the petri dish looks like, and this bright white blob which you see on the left side, that is the growth of mold, and those small dots which we see on the right side, they are the growth of Staphylococcus bacteria. So in between, we can see that there is an area where the bacterial growth is very small, and very near to the mold, it is almost not there at all. So that is how he realized there is something in the mold which is going into the nutrition medium, which is killing the bacteria. And he extracted that, whatever was present in the mold, and he made it into an injection, which was later named penicillin, because the fungus belonged to a genus called penicillium. So the penicillin was the first ever antibiotic to be discovered, and it has also helped save so many lives. And it is actually, even now we are using penicillin in very different forms of it, but we still do use penicillin to cure so many of the diseases, right from heart disease till the brain infections. We use penicillin on day-to-day basis. But I have to give you a word of caution here, that any of the antibiotics, antivirals, antifungals that you take, you have to take it in the doctor prescribed dose to the prescribed course. Because if you don't do that, then the germs are also very intelligent. So their immune system is also working like ours is working. So they know what exactly is coming to kill them. So if we don't kill them all properly in the given time that doctor says, whatever the germs are remaining in our body, no, so they will start developing memory, and they will start developing immunity towards this drug. So once the pathogen develops immunity to the drug, it becomes very difficult to treat, because we are still in the stages of development. We are still trying to find out new drugs against those things. But because of the ignorance, or because of some non-compliance to the antibiotics, there are new drug resistant species that are emerging every day. So please listen to your doctor. Even though you get better after 1 or 2 days of antibiotics, complete all your 3 days or 5 day course. Only then you can stop the antibiotics. So after the antibiotics like penicillin were developed, many such things like antivirals, antifungals, antiparasite medications, all of them started developing. And now we have a whole armory ready to fight against the parasites, I mean, fight against the pathogens. So now we know if there is any pathogen entering from outside, how to kill it, how to prevent it, how to cure the disease, all of that. But what if we have a bodily ailment? For example, we got a fracture, or we have something in our body that has to be removed. For example, there is an appendicitis. So we have to remove the appendix, which is causing you pain. So then what do we do? Or you have a cataract, you're not able to see properly. Your grandparents might have a cataract. They cannot see the images properly. They cannot see TV properly. They cannot read. So what do you do then?
Most of them say surgery.
Yeah, so surgery is another branch of medicine which also developed like the tablets or vaccines that we spoke now. So in these pictures, we can see that the surgery as a remedy was present since very long time. So we know that in India we had a sage named Sushruta who would conduct surgeries, so much so that he would do plastic surgeries, cataract surgeries, and all in those olden times. So, but what happened that time was we did not have proper sanitation. We did not have any medication to reduce the pain. So many people would have to bear the pain to undergo the procedure, or there used to be so many people around the patient to hold him back so that the procedure can be done on him. So that would be very difficult for the surgeon also, for the patient also to undergo a surgery or to do a surgery. So then came the need for something known as anesthesia. So anesthesia is nothing but numbing science. So they make your body numb so that you don't feel the pain. So as I told, pain is something that our body identifies as a threat. So once there is pain, our body knows there is something happening which is not supposed to happen. Our body is supposed to stay however it has come out of the womb, and it should not have any cut, it should not have any surgeries. So that is how we are supposed to be, but we cannot be like that in this modern age, right? So anesthesia was discovered to prevent the pain during surgeries. So do you know how pain is perceived in our body? What do you think takes the pain signals to the brain? So like in our previous example, we have a cut in our right thumb. So how does our brain know that there is cut?
Chokamal says nerves. Nitin says pain receptors.
Okay. So it is correct that there are pain receptors. There are receptors for all kinds of sensations all through our body. So pain receptors, they pick up that there is pain and they send it through the nerves to our brain. So in brain, there are also some centers known as pain centers, which can uh, interpret this message saying that there is pain and the body. So now to remove the pain, we have to stop this transmission in the nerves. So now we know neuron looks like this, and there are connections made in all the directions towards other neurons. And the any sensation will go from one neuron to another towards the brain, right? So you can see in this video, medial prefrontal cortex is nothing but a part of brain. So you can take it as part of brain. So in this video, we can see these bright green things, branching things are the neurons, and the bean-like things, this green bean-like things, they are the nerve cell, the actual body of nerve cell. So we are forming so many network with the neurons. Every second we are awake and active, doing anything, even right from blinking your eyes to taking a breath to moving your limbs or eating, walking, talking, even thinking. So everything causes so many billions and trillions of connections in our brain, which has to be uh, identified, which causes pain, and we have to silence that portion. So that is why we have so many medicines which are available, which can be through air, which it enters through our lungs to the blood, and then it goes to the brain. Or we can give it through IV injections. Again, it enters into the blood and goes into the brain. And it works precisely on those pain receptors. As Nitin told, there are pain receptors in the brain, also in the pain center, that will kill the pain message that is coming from the nerves, so that our brain doesn't perceive any pain. Okay, that is how anesthesia came into being. So now we know there are surgeries which are being done for so many different ailments and all of that. We might all have seen our grandparents struggling to walk and all of that. So before, I think around 50 to 80 years ago, there was not no surgery to help them or to cure them of their ailment. They would have pain in knees and they would try to walk around with that. But now you might have seen so many of your grandparents getting a knee surgery and becoming better. They can walk around, they can do their work by themselves. And they say that the pain has reduced. So, how does it work? So, nowadays we have something known as knee replacement surgeries. So, what does it mean is that the knee pain or knee pathologies occur because of the wear and tear as the person ages. So whenever the bones around the knee, they get older, they start having more friction and they send pain to the brain. So there is pain in doing everyday activities. So what do we do is we remove the pathological part and we replace it with a metal like steel, stainless steel or titanium into the same place, and that will help them in moving their knee easily, because there is no pain receptors in that is first thing, and there is no friction because it is a metal. There is not much friction in the joint and they can move around very easily. So we can have surgeries like this, the knee transplant, I mean knee replacement surgeries, to transplant surgeries. Like we nowadays we even do heart transplant, and the research is even going on for brain transplant also. So our science has grown so much that we can use someone else's heart to give life to someone else. We also know there are some other organs which can be transplanted. Can you tell what all the organs we can use it for transplantation?
Nirmal says I. I.
uh,
Yeah.
okay.
liver,
Liver, then
kidney,
kidneys.
Um, Liver.
Yeah. So
Retina.
uh, retina is not correct. We use cornea. We don't transplant the whole of the eye. We can use the cornea, that is a part of the eye that we can that we mainly use to see. So we use the cornea of somebody who is donating to bring vision to other people. So these
Yes.
are all correct answers. So that is how an organ donor can save someone's life by donating so many organs. So one person, one healthy person, if he has an untimely demise, so then he can donate all of these organs to different people and he can save their lives. As I told, heart is also one more organ which can be donated. So many other people will get benefited because of all of this. So now we can save lives by, in the olden times, the surgeries used to take someone's life because surgery would be so messy, they would lose a lot of blood, and even after surgery, they would have infections. But nowadays, we can do surgeries to save so many people's lives. So this is one more very recent development where you can see that the surgeon is sitting a little bit away from the patient while the patient is hooked up to a robot here. So you can see the robot is working on the patient while the surgeon is sitting away and guiding the robot how to do the surgery. So this is something known as robotic surgery. Here the surgeon has eyepieces from which he can see what is happening in the surgical field and he maneuvers the robot through his hands, which will be transmitted to the robot and it does the exact same thing that surgeon is telling it to do. So these surgeries have become very important in the field of neurosurgeries because we know that when we are operating on a particular nerve, we are not supposed to cut the adjacent, surrounding tissues or surrounding nerves, right? We want only that particular nerve to be cut or cured or to be sutured together, whatever. So that is how our surgical field has advanced from the olden times to now. Okay, this is known as robotic surgery. So now we know that whenever there is a disease, our body identifies it, then we can prevent it by vaccine or immunity, or we can find a cure for it, even surgical or medical. But how do the doctors know what has exactly happened inside our body and how do they know what to treat, where to treat? So, for example, I have a very severe tummy ache. I go to a doctor, I say, I have very severe tummy ache. I'm throwing up since one day. I have such high fever. I don't know what to do. So, how do you think the doctor will proceed?
Examining the patient.
Okay, examine the patient. So, I have examined the patient. Patient is telling correctly he has very high
Imaging
fever.
techniques.
Sorry.
Nitin says imaging techniques.
Imaging techniques. Okay. So, what imaging techniques do you know? Do I take a picture of the patient?
Ultrasound of this abdomen.
Ultrasound of abdomen. Okay. Anything else you know about imaging?
X-ray,
Answers like
Endoscopy.
MRI.
X-ray,
MRI,
MRI,
Endoscopy.
endoscopy. Okay. So, these are all known as imaging techniques. So, endoscopy, colonoscopy, bronchoscopy, they are all something known as scopies. So, they are something that we have to put inside someone's body to image whatever is happening inside. Okay, so in that also we somehow have to put some tube inside a person's body. But the imaging techniques or imaging science which is developed now, that doesn't need such big scope entering into a person's body to see whatever is happening inside. Okay, so we have a new branch of medicine
There's
now.
something called
Sorry,
there's something called as PET
sorry.
scan, PET.
Yeah, right. PET scan, PET CT, PET MRI, all of them are there. So all of them together make up a new branch of medicine known as radiology. So radiology is rightly called the eyes of medicine, and I specialize in radiology. So this is a very new branch of medicine which has developed since last around 100 to 50 years ago. So how did we find a need for radiology, or how did it come to existence? So it is all thanks to this person who is called Wilhelm Röntgen. He is known as the father of radiology. And he is called that because he found out something called as X-rays. So have you all heard of X-rays?
yes,
Yeah, so many of you have even undergone an X-ray of some part or something. So he was a physicist. So Ranjan was a person who studies physics. And when he was studying some electromagnetic rays in his lab, he found that there was a film which was kept away from him, which started glowing. So he thought, what is making that film glow? I am working here. That film, which is far away from me, it is glowing. Why is it glowing? So in the meantime, what happened was that his wife came to call him for dinner, and her hand came in between the path of his apparatus and that illuminating screen, and immediately the screen showed a picture like this. So can you all see this picture? Can you identify what is there in the picture?
Digits of hand.
Yeah, on the third finger, there is a difference between the third finger and the rest of the fingers. There is some
Which
lump
part is this?
The ring finger.
Yeah, which part of the body are we seeing here?
Palm of the hand.
Correct, that is the palm of the hand, and they are the fingers. And this bubble-like thing, black thing you're seeing is the wedding ring of that.
Ring.
Okay, that was Ranjan's wife's wedding ring, and that was for the first time he could see someone's bones without having to cut them open. So that is how X-rays came into existence. He called them X-rays because he didn't know what rays were they. So X as in unknown rays. So he called them that. And since then, since these kind of X-rays, we have come a long way to these kind of X-rays. We all now see X-rays like this. So in these X-rays, we can see air as black thing. So we can see that lungs which contain air are looking black, and all other tissues look in gradients of gray to white. So dense tissues like bone look white, and other tissues like heart or liver or skin, fat and all, they look in gradients of gray to white. Okay, so this is the story of how X-rays origin began to exist in, and then how the development of X-rays was done. So now we have come from there to something known as CT scan, MRI scan, and someone rightly told about PET scan, PET CT, PET MRIs. So CT scan is something that uses X-rays only, but there are hundreds and thousands of X-rays used here that it will form a whole image of the person's brain or abdomen or some part of the joint or something. So it uses the same rays as X-rays to image the person. Okay, but MRI is a different kind of a thing where it uses magnetic rays, because our body actually is a kind of giant magnet. So we all have a magnetic force towards the earth. So that thing is used as a principle to image the body. So the CT and MR principles are a little bit difficult for you to understand, but if you still have questions, you can post them on Xperimentor Instagram page so that I will be able to answer them. Okay, so yeah, someone wanted to tell something. Okay. So these are the CT and MR images. Here on the right side, you have a CT image of someone's brain. So this bright white thing in the periphery is the bone, that is the skull. And inside it, we have the brain. So CT is a little bit easier to read the bones, while MR is easier to read the soft tissue, as we call it, or other than bones. So here also we have a picture of someone's brain. Here we can see that how the brain's convolutions, that is the foldings of brain, have occurred. We can see the white matter distant from the gray matter. We can see the ventricles in the brain. So we can also see the meninges, which is surrounding the brain, right? So all of this can be seen in MR. But in CT, we can grossly see whatever is happening in the brain. So MRI is a relatively advanced technique. Okay, so PET CT and PET MRI, what they do is, they are a different branch of medicine known as nuclear medicine, where we inject a controlled radioactive substance. So the radioactive substance is made in the hospital and it is injected into a person's body, which goes and attaches to a tumor if it is present in the body. And it will make the tumor glow. So when we take images like this, when we do a CT or MRI, those things will glow. So that is how we know there is a tumor, and if it has spread somewhere, or if it has grown in size, or if it has come down in size since the therapy has started. So all of that can be identified on PET CT and PET MRI. So other than CT, MRI, and X-rays, someone also told about ultrasound. So ultrasound, if someone says scan arbitrarily, that usually means ultrasound in these days. Okay, so ultrasound scan is mainly used to look at the unborn babies. So we mostly do scans for pregnant women, because we are not supposed to use X-rays and CT scans if it is not indicated, because they're really harmful, and if you undergo X-rays or CT scans repeatedly, it can harm you. So that is why X-rays and CT scans have to be taken only on the advice of a physician or a surgeon. Otherwise, you're not supposed to do the imaging on your own. So ultrasound is best for looking at the unborn babies, because they have very little effect, very little to no effect on the pregnancy. So that is why we use them to look at how babies are growing, if they are healthy, so all of that. So what does ultrasound use? Ultrasound, as the name says, it uses sound waves. So they are ultrasound waves so that we cannot hear them. But when they travel into the person's body, so this yellow thing is the skin, and this black gray things are the ultrasound waves that are going into the person's body. And some of the sound waves are reflected back. So the sound waves which are reflected back, they come back into the computer and make a image of the thing which they were supposed to see. So in this case, this is the liver of a person, and this is how we see in the ultrasound. So ultrasound before nowadays looks like this. Okay, the person will sleep aram se on the couch, and the doctor will sit beside the patient and do this ultrasound scan. Nowadays, it has become so compact that there are many handheld ultrasound machines which we can carry to ward to ward, or we can carry it to the ICU and do the scan there only. We need not shift the patient to an ultrasound center or ultrasound room. But when it developed in 1980s, it was not like that. So we had to make the person sit in a water bath, and we had to move the machine around the person to get one image. So from that time, in around 30 to 40 years, we have come to this time where we can take the whole ultrasound machine in our hand and move around. So that was all about how long we have come from those days when we were using the local herbs and medications which were available, to the robots performing surgeries on guidance with a surgeon. So do you think in the future we can have AI robots doing surgeries all by themselves?
The poll is open. People have started responding.
Mhm.
Yeah, most of them say no. A few
Okay.
yes.
Okay. So can anyone tell me why do you think it's a no?
Ma'am, I have a question. How many times you encounter surprises during surgery?
Exactly. So you have answer in your question. So the AI or robots cannot do surgeries all by themselves, because all human bodies are not made the same. So some people will have liver on the right side, and some people might have it on the left side. Or some people may have a very small liver, some people may have a very big liver. Some people have only one kidney, some people have both the kidneys on same side. So the human bodies are made very differently, and surgeons are well equipped and taught to recognize that and respect that. But robots,
Okay.
we cannot at this
I mean,
moment.
you cannot, even if it is programmed to that degree,
Yeah.
the last minute surprises, I am curious to know, ma'am.
Yes, yes, exactly. We have encountered so many surprises, as you rightly said. So nowadays the surprises have come down because of the imaging techniques. So we
Okay.
have imaging which will be done beforehand during the surgery. For example, if you want to get an appendicectomy, that is, if you want to remove your appendix, we want to have an imaging so that the surgeon knows exactly what is going on, where he has to operate, and what he has to watch out for. So
Okay.
sometimes for some people the kidneys are in the lower down in the abdomen. So all of those things we can find out using imaging, and that is how the surgeon can get prepared for his surgery.
Okay.
So
Are all substances identified in screening techniques?
I didn't get your question, ma'am.
I
Substance.
mean, substance meaning like if a person is undergoing a uterus surgery and
Mm.
after the cut open they find that it has some sticky stuff substance outside it, and I don't know what is it called in your terminology, but
Yeah, no issues.
so do you
There are,
encounter such things, and can
yeah,
it
there can
be
be some things like that, because some infections which are growing inside the body, so that we cannot definitely see in surgery. I mean, see in imaging, so that we can see
okay?
only when we cut open. For example, if you have a tomato which is rotten and you want to image it, on the image it just looks like a tomato. But when
Okay.
you see it, you see that there is a mold which has grown all over it, and
Yes.
you, so if you wash it, the mold maybe goes off, but the mold is there. On imaging we cannot see the mold, we can just see that the tomato is not round in shape, it has changed its shape and all of that, but we cannot exactly see what is causing it, right?
Okay. Mm.
So there might be some things like that during surgery. So that is why the surgeons are better equipped than some robot or AI taking it over. So
Okay.
as of now, at least we cannot teach all of these things to robots. So that is going to be a very tedious task, and I don't think it is coming in any near future. So the answer is definitely a no.
No, and it should not be.
Yeah, that's right. So, okay, this is a fun question. If you had to invent a new medical device or a new medicine, so what would it be, or what would it do? So, what do you think
Mm.
should have been there? Are you, this had to be there instead of this?
No cancer, no BP, no sugar.
That is there, but okay, I have a very important thing to tell you. So that, do you know what is cancer actually? Does anybody know
Mm,
what is cancer?
If the
Is it
cells
an
growing
infection?
rapidly,
Sorry,
cells are growing
cells are growing rapidly.
rapidly.
Uncontrolled growth of these cells, no?
Some
Correct, correct.
Oh.
Free Abhishek.
I think your voice is breaking up. Okay, someone was trying to tell uncontrolled growth of cells, right?
Yeah,
Okay,
most of them say uncontrolled growth of cells.
yes.
has those are certain or would you under functions you can uh,
Sir, is it possible for you to type it in the chat box?
Yes, everyone who has answers and questions, please type it so that we can avoid all these audio disturbances. We will give you a chance to ask your questions towards the end.
Okay, so someone was trying to tell that cancer is an uncontrolled growth of cells. That is perfectly right answer. So whenever some cell of our body decides that it has to grow uncontrolled. I don't want anybody's control. I want to grow however I want, how much ever I want. So that causes the cancer. Okay, so there are some systems in the immune system itself can identify such cells, and it can control it for a while. So till some time, immune system identifies that this cell has become disobedient to our body. It has turned a traitor, and it will try to kill it as much as possible. But if the cancer is very big, or if it is spread to 2 or 3 areas, our body is now helpless, so it cannot do anything. So during such times, we will have to image it using PET CT, PET MRI. We will have to undergo surgeries. We will have to take chemotherapies. Chemotherapies is nothing but targeted therapies towards those cells. So such uncontrolled cells, they have some points to identify them, and these chemotherapy drugs are targeted towards those points. So it doesn't, or it will very minimally damage the healthy cells, and mostly it will damage the cancerous cells. And there is something known as radiotherapy, which will also try to, the radioactive substance will go and attach to the uncontrolled growth, and the rays which we send from outside, that will try to burn the cancerous cells. So that is about cancer. But do you think there is any infection that can cause cancer? Have you heard of any infection that can cause cancer?
Chokamal says HPV.
HPV causes what cancer, Chokamal?
Cervical.
Correct. So cervix is a part of uterus which, if infected by a virus known as human papilloma virus, HPV stands for human papilloma virus. So if that virus infects the cervix, then it can turn into cancer. And now we have a vaccine for that also. Because it is a virus, we can find out a vaccine for it. And we are trying to administer the HPV vaccine very rapidly, so that people can, the cervical cancer also can be eradicated. So once we take the vaccine, there are very less chances that a person can have cervical cancer. So that
Excuse
is
me, ma'am.
one cancer. Yeah.
I have a question. Can any autoimmune disease can also turn cancerous?
So autoimmune diseases, by definition, what happens is that our some of cells our body, some cells in our body are identified as foreign cells. So our body thinks that these cells are not mine, even though it is our own cells. So then what happens is, first thing what happens is, it will cause widespread inflammation. So you might have different pains or fever or uneasiness and all of that. Very rarely it can also develop into cancer if it's been there since a long time. So because the cells belong to our own body, we cannot go and destroy all those cells because we might need those cells. So we have to have a check uh, on the inflammation so that our day-to-day activities are not hampered. So it is a very tricky situation to treat because we know what is causing the disease, but we cannot take out that root cause. So we have to balance the disease with the day-to-day life of that person. And if that happens to be long standing for say 30 to 40 years or even 50 years, then that person might be under a huge risk for cancers. Okay, so towards the end of in the last two slides, we have something known as hand washing techniques. So during COVID, we were all told to wash our hands, sanitize properly, and to be aware of whatever we are touching, whatever we are using, right? So we have had something known as hand washing techniques since a long time, but it has been propagated very well during the COVID times. So we'll see what are the steps to wash our hands properly. Okay. So when do we wash our hands? Whenever we get home from work or outside, whenever we blow our nose, sneeze or cough, when we eat or handle the food, or even when we are interacting with a person who is sick. Okay. So we have to wash our hands for 20 seconds. So once we open the tap and take the soap, we will rub the soap on the palm, back of our hands, in between our fingers, and tips of the fingers, the knuckles, back of the thumbs, then the wrist. So that will complete the hand washing cycle. So I advise you need not keep the tap on for a whole 20 seconds. You can use it in the initial stages and in the end. Okay. So these are the 7 hand washing steps. We take the soap on the palm of our hands, we rub our palms, then we rub the back of our hands, we rub in between the fingers, the knuckles, the thumbs, tips of the fingers, and wrist. So that is how we wash our hands to prevent the diseases and stay disease free. So that's it. Anyone has any questions?
Thank you so much, Aishwarya. We've already received a lot of questions.
Yeah.
Yes, for everyone who's online now, We'll take up few questions which we've already received, and then we can open up to all of you because we are already past time. So we will be extending it for say 10 more minutes at max. We'll try to address all the questions, but if not, please email us.
Yeah, you can type it on the Xperimentor Instagram page, or you can email to Xperimentor so that I can get the questions and get back to you.
Yes.
Ma'am, one small question from my end.
Yeah,
Yeah, about the previous presentation, anesthesia.
yeah.
That if a patient undergoes for the brain surgery, how it happens?
Okay, so this is a very important question. So there is something known as neuro anesthesia, where we can anesthetize the localized part of the brain. So there are different types of brain surgeries. So if there is a tumor which we have to remove, or if we have a bleed which we have to remove, then the person gets anesthesia like a normal thing, like normally and how we get anesthesia, and we are knocked off. So that is how the anesthesia is given and the brain surgery goes on. But there are some surgeries for which we want the person to be awake. So such neural surgeries, we anesthetize only a part of the brain so that other part of the brain is actively working. So we actually ask the person to speak. We ask him to tell us a story about his life or some story, or sometimes they ask the person to play music, play an instrument that he knows, so that the other parts of the brain are working and we can go on working about the anesthetized parts. So that is a very nice and important question that you have asked.
Okay, so we have two questions in the chat. The
Yeah.
first one is reverse aging possible?
Okay. So for that, you should know what aging is. Okay. So we know that we all have cells from the time we are conceived. So we are all born from a single cell. So as we grow, the number of cells keep on increasing and it will stop at a particular time. And after that, whichever cells are lost, that those cells are replaced by the body. So how does the body know how to replace which cell? So for that, our DNA has something known as telomeres. So you all know about the chromosomes, DNA and all of that, right? So something known as telomeres. So you can think that as a small flags which show that I am aging cell, I am an old cell, I am an Aja cell. So such cells, they get removed from our body. So for example, you know that the skin gets replaced every so many days, or the gut gets replaced every so many days, the inner lining of the gut. So all of that is done because our body sees that these cells have telomeres active and they will be removed off. So the research is going on to see if we can silence these telomeres, or we can even cut these telomeres off so that we can prevent or slow down the aging. But the problem with this is, if we cut off these telomeres, the new cells are anyway coming out. And this might lead to uncontrolled cell situation causing cancer. So reverse aging is not practically possible as of now, but it is theoretically possible.
All right. The next question is, doctors at times say that the infection or disease is self-limiting. How does this work?
Okay, so self-limiting in the sense, our body can work by itself to prevent something. So as I told you, if you have a cold or cough or some fever because of some gut infection, you might have had loose motions or vomiting. So then we need not put a scope into your body and see for the first time if you have had vomiting and loose stools. We don't go on putting a scope into your body and see what is happening inside, right? So that is when we say it is self-limiting. Let us see if the body takes care of itself. So that is how we ask the immune system to come forward and do the work. So if the person's immunity is good enough, so the disease will get cured and he will go on leading normal life. So if not, then the external remedies will have to step in. So self-limiting in the broader sense is this.
And we've received some interesting questions when we opened it for registration. So we're picking a few from that.
Yeah.
So one question is, when curing diseases through radiation therapy, will it also kill cells that are necessary for good health?
Yeah, so as I told you, the radiation therapy works I mean, there are some radioactive substances which go and attach to the cancerous cells, and we provide the radiation from outside, right? So during that time, what happens is it has to pass through so many layers of our body. So those cells also get affected. So that is why the cells which get rapidly regenerated, for example, the gut cells or the skin cells, so they are the ones which will get affected the most. So the person who is undergoing radiotherapy might have dermatitis or itchy skin or redness in the skin, or he or she may have vomiting, loose stools very frequently. And as we all know, they also tend to lose a lot of hair. So they are all the side effects. They are definitely bigger side effects, but we have a very big threat to kill. So compared to the cancer, the people think that having loose stools or dermatitis will do because we are fighting against cancer. So definitely chemotherapy and radiotherapy both have these side effects where we lose some of the cells which are required for us also.
And there's one question, how to build strong immunity for kids?
Oh, this was the question I was expecting. Okay, so we know that there is something known as immune cells, but how do we replenish our immune cells? How do we replenish our immunity? So we have to have something known as antioxidants. So where do we find antioxidants? We find antioxidants in the green leafy vegetables, in the colored vegetables like beetroot, carrot. So whatever we are provided from the nature that has so much of nutrients for us that we undermine their value very much. So you need to eat all kinds of vegetables, all kinds of fruits to be healthy. So the citrus fruits, the amla or gooseberry, the oranges, musambi, so all of them have so many very important things that we need to keep our body healthy. So the amla and oranges, they're full of vitamin C, and vitamin C is needed for almost all kinds of immune cells production. Then green leafy vegetables. Then there are some other fruits like guavas, papaya. So all of them have so many things that are required for us. That is why the balanced diet is the main thing to improve our immunity. So to prevent the diseases. So nobody should say no to any of the vegetables or fruits or green leafy vegetables from now on.
There's a question from a teacher.
Yeah.
How can I maintain my health in terms of keeping myself energetic and with vigor through most part of the day?
Okay, so this is something we all face. So especially if we are working, by the end of the day, we are dead tired. We cannot get up and move, right? So there are so many factors which pitch in. So if you are a very active person, you have worked out in the morning, you have done, you like your work, you have worked well. So you come back home and you're energetic. But if you don't like your work, you have been lethargic since morning. So that is when you feel like, oh, it's okay. It's one more day, just one more day. It's fine. I'll do it tomorrow. So that is one part. One more thing is that again, we have to have balanced diet, but the main thing is we have to have our hydration on point. So many of us, we don't drink enough water, maybe because we don't have safe places to safe washrooms or something. But the main point is that we have to keep ourselves hydrated for our brain to work properly. So the water and glucose are two things that are very much needed by our brain to be working non-stop. So we have to give it to the brain so that we are active throughout the day. So I think if you work on your mental health and the hydration and balanced diet part, I think you will be set.
So there's a radiology question now. Which part of anatomy is not recommended for radiology test, and will radiology detect malfunctioning of medicine?
Okay, so radiological, so there are some imaging which is not required, which is not recommended for the genitals. For example, the testicles. For the CT and X-ray is not generally recommended because they are harmful for the production of sperms. But we can use ultrasound and MRI for that. What was the other part in the question?
Can radiology, will radiology detect malfunctioning of medicine?
Malfunctioning of medicine, as in I didn't clearly get the question. If you mean the side effects of medicine, we cannot say which medicine caused it, where does it cause or something, but we can definitely say if there is something wrong going on inside the body.
All right, so we'll take the last question. With that, we can close, I think.
Okay.
How reliable will AI-based diagnosis and recommendations be given to vast amounts of data available? How does this impact the role of a general physician?
Can you tell me the first part again?
How
Yeah.
reliable will AI-based diagnosis and
Hmm.
recommendations be given to vast amounts of data available?
So AI-based recommendations, why are we giving AI-based health recommendation to the data? So I think
I think
what
using the data, yeah.
Oh, okay. So, so as I already told you about the surgery, not all human beings are exactly the same. We are not carbon copy of one person to another, right? So whatever works for one person need not work for another. You might have seen in your home only that some person who is taking some X medicine for BP or sugar, and one more person, if he tries to take the same medicine, his BP or sugar might not be under control. So that is how differently we are all made. So, AI-based medicine recommendations or AI-based techniques, they can help the doctor, and they can say, okay, I think this person might have hypertension or this person might have diabetes, and these are the possible drugs that you can give to them. But they cannot by themselves suggest that this person has hypertension and this person has to take this medicine only. So AI can definitely be a friend to a physician. It can help make diagnosis if we punch in some of the symptoms, something like that. But they cannot on their own make a diagnosis, because we are all made very unique, and we have to have that human touch before diagnosing someone of something.
I think that's the end. Yeah, for those of you who have any more questions, I would recommend you to email us. We've shared the email ID with you on the chat. I'll be pinning it for you so that you can see it. And we have also given you our Instagram account name. So do drop a message also, and we'll get back to Aishwarya and get you all the questions answered. And thank you so much, Aishwarya, for taking the time and for such a nice story of the entire story of medicine you've covered in a short time. And it was very engaging and very nice. And thank you for all the polls that you posted and all the questions that you answered. And yes, the audience also came up with very interesting questions.
Yeah, thank you so much for the opportunity. And I hope it was not boring because it's the first time I'm trying to tell something about, tell some medicinal stuff to someone else. So if it was boring, also, you can tell me. It's fine. I'll try to improve for the next time.
Not really. I think everybody is giving a thumbs up, so and hearts. So I think everybody loved it.
Thank you. Thank
Yeah,
you very
you
much.
are receiving some good comments. So yeah, do check it out at the end of the call.
Yeah, sure.
Yes, thank you everyone for joining today. We will have our next session coming up on the 4th week of September. We will be posting more details about that session, which is on 27th of September. Please do join us for that as well. And yeah, share the word, spread the word to your friends and family, and ask more of them to join. We have some very interesting speakers coming up. So yes, thank you all for joining, and thank you, Aishwarya, for your time and for all the interesting information that you shared with us today. Good evening and bye to everyone.
Bye. Thank you.